And so now to introduce our guest today, so Dr. Parney, he plays very like a number of roles here at Mayo Clinic, very important ones to say the least. So not only is he the vice chair of research in the Department of Neurosurgery, he's also the vice chair of admissions committee here at Mayo Clinic Alex School of Medicine. So we're very glad to have him join us today. And so the way that this is going to work is that we're just going to kind of prime Dr. Parney with a couple of questions here off the start. And then as you all have questions, feel free to put them in the chat and we will moderate it and ask Dr. Parney. So I guess kind of the first question, that's a generic question for you, Dr. Parney, is what do you wish students knew before applying? So what do you think is important for them to know?
Well, first, just thanks for the opportunity to come and chat with everybody today. I think this is a really great program. I'm really glad that you've been able to reach out to so many people across the country this way. So yeah, as you mentioned, I kind of have a couple of hats. You know, obviously I'm a neurosurgeon and I'm a cancer researcher. I have administrative roles in the department, but one of my roles is as the vice chair of our medical school admissions committee. And I guess the one thing, there's many things. We can sort of talk about what the admissions committee looks for in general, what kind of big bins of information that we look for. But I guess if I had to sort of give one hint as you sort of think about crafting your applications to medical school and your interviews and things like that, remember that we're looking for people who are interested in helping other people. We're looking for signs of empathy. We're looking for signs that you're interested in being part of a team that works at that. There's probably nothing that's a bigger flag than somebody comes in and says, I did it all. I did all this exciting stuff. And then you say, well, no, we want somebody who's going to work with everybody and have their priorities in other places. So if I had to have one thing, that'd be it. There's lots of other things that we could talk about.
Sounds good. So then I guess kind of another question is because there's so many people that generally apply for very few positions, what are some ways that students can make themselves stand out without kind of throwing in those red flags like you were just talking about?
Right. I mean, I think that there's a lot of things that sort of go into this, and I don't know that there is any one single thing. I mean, obviously, if you're an Olympic athlete or you've performed at Carnegie Hall or you've published your first novel, well, tell us about that. That's going to make you stand out. But most people are mere mortals, and you know, they don't have quite the same things as that. So I think the things that you want to make yourself stand out are your marks. You got to work. You have good marks. They're important. They're not everything. I think some evidence that you've really sort of thought through why you want to go to medical school and that you've applied yourself to that and taken full advantage of all the opportunities that you've had. It's kind of a buzzword amongst admissions committees and other things like that to look for grit, you know, some sign of stick-to-itness. And that can have a lot of different implications. And so you might think that maybe I don't have that, or I haven't done, you know, something that sort of fits that way. Think carefully about that in your own background. If you happen to have, played piano, don't just sort of write in your application that you played piano. Let us know exactly what that means. I played piano for 12 years. I performed. I did these things. It's 10,000 hours that I've done doing that. That I understand what that means. You said, well, you know, maybe I didn't have the opportunity to do that because I was busy looking after my family and working a job or two jobs or three jobs or something like that. You know, go on, how am I going to make my application stand out? Well, tell me that. Those are the things that will really have an impact that way. So we want to know about you and be honest and open about that and put yourself in the best light that you can.
Yeah, no, that's definitely great advice. I wish I would have talked to you before applying to medical school here, but
But you got in, so what are you worried
I
about?
did, so it worked out, yes.
Yeah.
So then I guess kind of my last like preform question before we start talking or before we start answering questions in the chat is, so obviously the road to medical school is a very long road. It's a very tiring road. So do you have any advice for how students can stay motivated for pursuing their future goals?
So I think that you're right. This is a marathon, not a sprint. And it doesn't actually stop when you get into medical school. Medical school is kind of hard, and then you got to work through all of that, and then you're going to do a residency and figure out what you're going to do that, and then you're going to be a doctor at the end of that. You got to work through all those types of things. So the things that I do that I think are important to me now, that were important to me then, is maintain that balance. We actually want people to be physicians who can empathize with other people and can do that sort of hard work of making connections. You're going to need to have balance in your life to do that. So maintain your connections to your family and your friends, maintain your other interests and things like that. And you have to balance those things out. Sometimes you just got to work and you got to work hard, but that's not your entire life. And we don't want it to become your entire life.
Yeah, great. Thank you very much. So what I'm going to do is I'm going to switch over to the chat now. And so just so all the participants know, I'm not going to necessarily go in order. I'm going to try to keep it with common themes that we're talking about, but I will try to get to all the questions eventually. So if you see that I skip over your question, no worries, we'll come back to it. So we also want to get to know you a little bit more as well and kind of your experience, Dr. Parney. So one of the first questions relating to that was, what was your experience in entering into medical school?
So I'm Canadian, and by well, you know all about that. We're from the same part of the world. In Canada, you can actually apply to medical school after your second year of university. Not everybody who applies at that point will get in. Most people do have a degree and things like that. But I applied early and got in and sort of worked hard through that. But my process of sort of getting into medical school, getting into residency, and what I ended up doing really was something that took shape over time. So I'll say first off, I never would have gotten into Mayo's medical school if I was applying with what I was actually applying with at the time that I was applying. In other words, I had good marks, but they were not sort of the most spectacular in the world at that time. I had pretty spectacular marks through medical school because I worked hard with that. But in my application, they were good, but they weren't stellar. There was, somebody had asked me at that point, would I want to be involved in research? And I said, no way. I said, I'd want to go to graduate school if I wanted to be involved in research. I want to look after patients. Well, things changed since then. I've been to graduate school and I'm a clinician scientist and the research chair at an uber academic neurosurgery department. So your interest will evolve over time and be open to that. Similarly, I didn't actually have any idea that I wanted to go into neurosurgery when I was applying to medical school. For whatever reason, I hadn't really thought about surgery as a subspecialty at all, and had kind of thought that I'd be more focused on internal medicine. And I'd taken an endocrinology course somewhere along the line, and I thought that sounds interesting. Maybe I'll be an endocrinologist. And I very, very quickly realized once I got to medical school that was not going to be for me at all. And I really liked the more immediacy of a surgical specialty, really liked the anatomy. I love the dissection. I love the neuroanatomy and the whole neuroscience process. So that's kind of where it led me to a path that I wouldn't have predicted when I was maybe at the stage that the folks on the Zoom call are at right now. So just be open to that. Your ideas of what you want to do now may evolve, and you may decide that you want to do different things as time goes on, and that's fine. That's good.
Yeah, that's great advice for sure. So now kind of looking at your hat as a neurosurgeon here at Mayo Clinic. So one of the questions is, what is your favorite part of neurosurgery?
Too many to narrow it down to one. But truthfully, it's the people, it's the interactions. I mean, I love, there is nothing, I sort of compare, people ask me about my sort of research and clinical things, and I go back and forth on this. But, there's nothing in the research side, for example, that will compare to the sheer visceral thrill of being able to see somebody, go through their signs and symptoms, their physical exam, the imaging, from your knowledge of the anatomy, predicting where the problem is going to be, seeing it on the imaging, going to the operating room, putting your hands on that problem, doing something about it, seeing that patient wake up and do well, be able to speak to them and their family afterwards. I mean, that's a tremendously rewarding experience to do. So, I mean, I think that's the main thing that drives me. Like every surgeon, I love being in the operating room, right? I'm never looking at the clock in the OR. It's just something that I really enjoy spending that time there. But it's why I'm there that really drives that, which is to be able to help people and see them do well.
So then kind of a similar follow-up question. One of our participants is wondering what kind of characteristic would you say is most beneficial to have as a surgeon?
Genius, looking gray, handsome, no. Um, I'm being facetious if anybody is wondering. I think that there's a lot of different surgeons out there that come from a lot of different mindsets. And I'll say first, maybe what I think a surgeon is not. A surgeon is not some of the things that you stereotypically think of a surgeon being. A surgeon is not a jerk who is just mean and cruel and yells at people and does things like that. There is no reason to be unpleasant to anybody under any circumstance, let alone in a stressful situation like that. I would say a surgeon, one of the more kind of unifying characteristics is somebody who can keep their head in a difficult situation. Who's not going to panic, who's going to be informed, who's going to make thoughtful decisions under stress and manage things that way. You do have to have a certain amount of confidence in your ability to get things done. I mean, from coming to the operating room and shadowing in my OR, scrubbing in cases, we make some pretty big holes in people's heads. You have to be confident that that's a good thing to do and that you're going to help people doing that to do that. And that's not based on just sort of an innate sense of, well, I'm just a confident guy, so I think I should be able to do that. You have to really understand and be detail oriented about how you get to do that safely and what's important and what's not with that. But I think that ability to synthesize a lot of information, make difficult decisions, sometimes under pretty significant pressure, I think that's maybe a unifying theme amongst surgeons.
Great, yes. So now kind of switching back to the medical school aspect of things, we've got a couple of questions coming in. So one of them is there one particular student, application, or interview that stood out the most to you and why?
Yeah, that's a good question. I don't know if I've never ranked them that way. There's different things that stand out to me. I mean, you do meet some just spectacular individuals that have done incredible things, who are Rhodes Scholars or literally have published, books and novels and things. And there's just some very interesting people that way. I think, one of the things that is my personal thing I tend to ask a lot of people is because, medical school can be kind of a difficult and challenging time. Being a physician can be a difficult and challenging time. So I often ask people what they've done, give me an example of something that they've done that was difficult. I think one of the best answers I ever got to that was person who had been a naval officer on a submarine, a nuclear submarine. And their role in that nuclear submarine was to be the head of the electronic communications or things like that. And said they were assigned on an actual mission to be, following a frenemies submarine without being noticed. Their internal email broke, but they couldn't sort of get to the surface to get repairs because they were on this mission. And sailor that was under this officer's command directly was acutely suicidal, and they couldn't, go and get help for that, professional help under this circumstance. And so this officer then had these three competing and truly life and death things that they had to kind of manage. And I thought, well, that qualifies as a difficult thing to have done. And I was impressed with that answer. So, but I think I don't want the people on the call to come away from this thinking, well, I don't have anything like that. How can I possibly compete? I mean, that's a unicorn to have had that experience. That's not what we expect for everybody. And most people, particularly applying to medical school, don't necessarily have that kind of life experience, to have even been in a situation like that. And that's okay.
So that leads really into kind of the next question here is how do you think that the admissions process for Mayo is unique? What's kind of the things that like Mayo looks for in general for their applicants?
So, I mean, I guess what I'd say is that there's a couple of things that I can tell you about our process. I have actually been on admissions committees for other medical schools in Canada before coming here, so I have a little bit of perspective. There's certain things that are going to be fairly universal, and I think a lot of what we do is fairly universal here. Certain things that are going to be a little bit more Mayo-centric, so the universal things. Looking at marks, your grades, your MCAT scores, and things like that. They're important. They're not the be all and end all, but they're something that you're going to need to have focus on. I think, as we talked about, we're interested in people who have some sign of empathy, that you can relate to others, that this is not about you, that it's about other people, that you want to do things that way. And a commitment to medicine, which can be exhibited under any number of ways, shadowing your course load or things that you've taken, research that you may have done, other experience, work, job, what have you, that might sort of speak to that. We look for people that know something about our medical school, and this is, although it's unique to Mayo, it's not unique. I think every medical school is like that. So if you're applying somewhere, particularly if you get to the point of an interview, make sure that you know something about that medical school, because they're going to ask you, why are you interested in coming here? And your ability to be informed about that is going to be helpful to you. We look at a few other things. Folks who are from underrepresented minorities in medicine. We look at people with military backgrounds. We look at people with connections to our community. And so I think all of those things in a holistic approach sort of impact the decision-making process. But it's a combination of things. Mayo is, ranked as the #1 hospital in the country and the world. The medical school is ranked as a top 10 academic medical school in the country. I personally think it's the best medical school in the country, period, full stop. So it's pretty competitive. And as I said, although I had pretty good marks and MCAT scores when I was applying, there's no way that I would have. I think I would have gotten an interview. I think if I had been applying, I'm not sure I would have been accepted here. So, and maybe that actually gets back to something that you asked me before. What would I tell people to remember about this whole process? Remember that this is not the final word on your life and career. And remember that there's a certain amount of dumb blind luck that comes into this. Somebody's got to open up your application and say, yeah, I think we should interview this person. And then somebody's got to, in your interviews, that's got to go well. People say, yeah, I like this person, and do those types of things. And so I guess just bear that in mind, that it's not an absolute judgment on your abilities or skills or anything like that as you go through this.
Yeah, and just to echo that point, as someone who's obviously gone through the process as well, it's very hard not to take it personally, but that's very reassuring hearing that coming from you. Just kind of, again, some of it is chance, for sure. So now if we kind of look into like the medical application itself and some of the components. So some of the students are wondering, what are some good ways that students, like pre-medical students, can get experience in working with patients?
So I think reach out to physicians if you have any sort of connection that way to shadowing. Unless your primary care physician that you grew up with. I mean, that's a good opportunity. But also, you're at a university. If your university's got a medical school, reach out to the physicians there. To say, is there some way that I can get involved and shadow? Often what people will do is say, I'm going to connect over a summer and work in a research lab, at a medical institution. And that's a good way both to get experience about biomedical research, which is important, but it also gets you into that institution, and then you can sort of talk to other people and have the opportunity to shadow and do things that way as well. Volunteering in a hospital. I volunteered at the Montreal Neurological Institute when I was an undergrad. I was at McGill University in Montreal. And the irony is that I had no idea that I was interested in what ended up as a neurosurgeon at that time. And so I was there because everybody said, oh, if you want to apply to medical school, you'd better be a volunteer at the MNI. And so I had done this. What I hadn't realized is that it was like one of the massive centers for development of neurosurgery in the history of neurosurgery. I had no idea at the time, but take the opportunities and volunteer at various places if you can too.
So then kind of moving into something that was obviously a hot topic of the past couple of years was COVID. And so how would you say that's going to affect students that just because of circumstances, they weren't able to do research, they weren't able to volunteer? So kind of how's that going to affect them? What can they do moving forward after this?
Yeah, I was talking to somebody about this the other day, and I think I don't know the answer to that, except to say that I think everybody's in the same boat. So a lot of the things that if you're sort of getting ready to apply for medical school now, you're all going to be in that same position where there's going to be a year where you really couldn't do much of that, a year or more, year and a half. And we get it. We understand that. I would also say though that we look at more than the last year and a half of your life. And so again, getting back to the idea of grit, of the idea of kind of sticking to something, we do want to look at that. And honestly, if you've said, well, I only decided that I wanted to do this in my last year and a half of college, and I hadn't really done that before, I get that. But maybe if you don't have that experience, you do want to do something, get a job, whatever, that's going to get you a little bit more experience so you can, have a better idea as to whether you really want to do medicine at that point. But I think most people sort of coming through this on admissions committees, we're going to have to recognize that everybody's going to be more or less the same boat, that there's this period of time during the pandemic where access to that kind of stuff was limited.
So that leads really well into another question from one of our participants who says that she's planning to graduate in 3 years and take a gap year to apply or before applying into medical school. So she's wondering if that might be a disadvantage applying early, and would a gap year experience help her out in that kind of situation? So if you could kind of give your overall opinion on.
I would say, I'll tell you what I think the answer is to that and what I think it ought to be. They're not necessarily the same thing. I actually do think that taking a gap year probably is helpful in your medical school application in general, at least around our medical school, because I think there's a lot of emphasis placed on life experience. And it's pretty hard to get life experience without, some life experience and being older. I'll tell you that I personally am not a huge fan of that. Partly this comes from, being a neurosurgeon, that I spent 18 years of post-secondary training before I finished things. And that seems like a long time. And so to add an extra year or two in there just because seems kind of egregious to me. So there's certainly going to be people like me on any admissions committee that are going to be thinking, yeah, if you can come through straight through and you haven't done any gap years or anything like that, that's just fine with us. But there are going to be people that are going to say, well, I'd like to see, how much other life experience you've had. And there's really only one way to get that. So I think different pathways to get into medical school. I don't think it's the same for everybody. But I think that it's not unreasonable to think about taking a gap year, and it certainly wouldn't hurt your application.
Yeah, that's great advice. So in last kind of question, in looking at admissions before we transition back to you, there's a couple of questions from people about dual degree programs. So one of them is someone looking at applying to a MD MBA and how would they be evaluated? And then probably similar MD PhD. How is that evaluation going to look different than a strictly MD applicant?
Right. So I can probably talk more about MD PhD than I can about MD MBA. I think different schools have different criteria for that, and I don't actually know how that works. So we've had some students at our medical school that have done MBAs in combination, but they're not really, it's not considered as a separate applicant pool. You're in the main applicant pool with that. The MD PhDs for us, and I think for most programs, it's a separate applicant pool. So if you're applying to an MD PhD program, in some ways it's fairly competitive, right? It's more competitive than the regular school because there's fewer slots for that. And you have to have some street cred as a researcher. I'm not saying that you have to have published, 5 first author papers in Science or anything like that, but you have to have actually said, I have done some research and I've had some experience with this. And so that's a particular scenario where it could be very helpful to have done a kind of a gap year, for example, working in a research lab, getting a little bit more experience that way before applying to an MD PhD program. I think both are fine and good. I think, so it may be a little bit more competitive for an MD PhD program. I hold both MD and PhD degrees, and I'm a big fan of being a clinician scientist, and I encourage that for everybody. And if you're interested in it, one way to do that is to do a combined MD PhD degree. It's not the only way. And you should recognize that too. So you shouldn't think that if you were interested in being a clinician scientist, but you didn't get into an MD PhD program, went straight into a regular MD program, that means, oh, you can't be a clinician scientist. That's not the case at all. You could do great research as a physician without getting a PhD, and some of the best translational scientists I know do that. Are MDs without PhDs. You can do a PhD afterwards, either right after medical school before residency, or like our neurosurgical program, we actually have an enfolded PhD for people who want to be neurosurgery residents and PhD students at the same time. So there's options that way.
Sounds good. So now switching back to kind of you and your journey to where you're at now. So there's a couple people in the chat who say that they're interested in both the neurological and the psychiatric aspect of the brain in general. So for you specifically, what made you choose to go into the neurologic aspect of medicine rather than the psychiatric aspect?
So I think it comes down to a couple of things, probably similar to why I chose to do neurosurgery as opposed to neurology. And so part of it is the relative acuteness, and I think you have to sort of evaluate your own personality. I figured out fairly quickly once I got to medical school that I was a little bit more oriented to acute care. I like to be able to see people, see a result, and go forward. Whereas internal medicine or psychiatry is often a much longer and incremental relationship. Very important, but it just wasn't going to appeal to me as much. The other thing for me is that I liked the physicality of operating. I liked dissecting. I liked the anatomy and being able to put my hands on things and do things about things, which is different than you would get in, say, psychiatry or neurology or other kind of non-procedural things. So that's what kind of drew me to surgery amongst all of these neuroscience possibilities.
So the next question is, as an established surgeon, how do you continue to grow in your confidence and ability?
Well, it's like the line, how do you get to Carnegie Hall? Practice, practice, practice. So it's the same idea with surgery, is that, you have to be informed, you have to keep up with your reading, you have to go to meetings, you have to talk to people, but, basically you got to operate. And so as a clinician scientist, one of the things that I like about being at Mayo is that I can protect, I've got a 50% research position and a 50% clinical position, but Mayo is so efficient clinically that I can see and treat probably as many or more patients in my 50% position than most full-time neurosurgeons will see and treat in a given year. To be able to have that volume of expertise to be subspecialized, there's certain things within neurosurgery you wouldn't really want me doing. You probably don't want me putting screws in your back. That's just not what I do. But I'm a brain tumor surgeon, and I'm very experienced at doing that, and I sort of build on that experience as things go forward. But yeah, you just got to operate. That's the thing.
So we've talked a lot about your role as a neurosurgeon. So now kind of looking more to the research aspect of it. So one of the participants is wondering what influenced your decision to focus on cancer for research rather than other neuro-related topics? And kind of like if you can take us through your journey, because yours wasn't the MD PhD direct journey, but it was something else.
So kind of all of this happened, and I sort of had this change from thinking that I would be purely clinical and maybe an internist to thinking that I wanted to be a surgeon, a neurosurgeon, and a clinician scientist. All happened really in the course of my time in medical school. And they're related. It was partly that I had decided or was beginning to think about applying to neurosurgery as a residency, and people were telling me, well, that's a pretty competitive thing. You probably want to have some research experience. And okay, great. I don't really want to get any research, but fine, I'll go do that. And so I'd taken a course, my first year of medical school, we had an immunology course, and I thought that was kind of interesting. So I talked to the professor, and I was able to get a summer student job working in this immunology lab. And I completely got bit by the bug. I really like this. I like doing research, and I liked immunology. And so then I was looking for a way, how can I combine this with an interest in neurosurgery? And a very nice way to do that was an interest in brain tumor immunology and immunotherapy, which is what I've worked on for 25 plus years now. That was sort of how I got to that idea. There's more to it though than that. I really like brain tumor surgery. It's satisfying. I remember talking to it was my father, my older brother, or somebody when I was a teenager and looking at summer jobs, and they were both, or somebody was recommending to me that you wanted to have a job at the end of the day that you could really see what you'd done, that you'd moved one stack of bricks from here to there, or something that you could measure like that. I feel that way a little bit about taking out brain tumors. You've done something there that you can see, measure, touch, and feel. And so I liked that. I enjoyed that aspect of it, and I enjoyed the some of the things that we can do in brain tumor surgery with awake craniotomies and mapping motor and speech areas and things like that. So that got me interested again more on the tumor side. That fit very well with my research interests, and sort of try and dovetail those together. Here I am, a brain tumor immunology researcher.
That sounds like it worked out quite well for you, that's for sure. So obviously you're a very busy individual with all the responsibilities that you have. So we've got a couple of questions about how you balance your work and your life schedule, that work-life balance.
Right. I'll tell you when I retire. It's hard. It's busy. There's just sort of no getting around that. This is a busy career. And it's a busy choice amongst other sort of options in medicine. And then to be a clinician scientist on top of that is also busy. Though I would say, if you want to succeed at anything, you're going to work hard and be busy. It doesn't really matter what you choose in life. So there's that. I think it's just key and important to make time for your family and your friends. Make time for your other interests and your hobbies and things like that. Make time for exercise. I'm married with kids. Faith is very important to me, and so we're connected to our faith community and church that way. I run a lot. Typical neurosurgeon. I'm a little obsessive. So I run marathons. I try to run 1 or 2 per year. So I do that. And then music is hugely important to me. At one point, before medical school, thought maybe when I was in high school that I'd be a professional jazz musician, until I sort of had some honest conversations with myself about skill level and a few things like that, and decided maybe I don't want to do that. But music is still very important to me. So I actually sing in a choir here in town. And so you take the opportunities that you can. I do things, some of this is a choice of how and where you choose to live and structure your life. I always think you could live, people have different views. You'd say, I'm going to live as far away from the hospital as I possibly can, so that, when I'm home is home. When I'm at work, work is work. I've always taken a different tack to that. I actually live 6 blocks from the hospital. I've always wanted to be within walking distance because I don't want to spend any time commuting. And that sort of plays out in where I've chosen to, build my career. One of the things that Fred Meyer, who's the dean of the medical school now, one of my senior partners, he's the chair of neurosurgery when I was getting recruited here, said to me about being at Mayo, being in Rochester. He said, you can have a world-class practice, a world-class research program, a world-class educational program, and still know your family. And that's not as easy to say in some other, bigger metropolitan centers, or at least there's other hurdles that you'd have to overcome. I think it's possible everywhere, but it's an advantage of being here for sure.
Yeah, it definitely sounds that way. And thank you so much for sharing this, because I feel like for us that are, in the process of going through our schooling, eventually starting up careers, it's very important to get on this early, I feel like.
Yep. Take time for yourself. It's important.
Yes, exactly. So kind of transitioning now back to the admission stuff, we've had some more questions come in. So this one's looking at personal statements. So do you have any advice about like writing a compelling personal statement, or what will really make someone stand out with that?
So I think stories. Everybody likes stories. So if you have a story to tell about yourself, or something that illustrates your interactions with others, or things like that, I mean, I think that's just sort of a good thing. I keep coming back to this point of, you want to emphasize your ability to relate to others and work well with others. So the word I should kind of be your enemy when you're reading through your thing. And it's tough because you're trying to tell us about yourself. How do you do that without using the first person singular? And I guess my answer is, we'll use the first person plural. Anytime that you're thinking about writing something, I had this experience, I did that, or the other, try and see if you can flip that and say, well, I was part of this great team that did this, and we had this great experience. We were able to help someone in this way, those types of things. It gets pretty tiresome sometimes when you read a story about somebody who's, well, I did this, I did that, I did the other. And at a certain point you think, well, yeah, you'd be hard to spend 5 minutes with. I think if you can emphasize that you're sort of part of a group, part of a team, and make it communicate what you need to without making it sound like you actually feel it's all about you, I think that would be key.
So now looking at other aspects of the application, so in terms of experiences, are there certain experiences that you would say kind of stand out better than others in terms of like scribing versus volunteering at the hospital? Is there a way that the admissions committee balances them?
No, I don't know that there's sort of a magic formula that you say, oh, well, if you've done this and that and that, that's going to sort of get you there. I think it's, as I said, it's kind of more, have you taken advantage of the opportunities that you've had? And so if you were in a place where you could have been volunteering, you could have been scribing, or you could have done research or things like that, and you didn't, that's going to come through. If you conversely are in a situation where that just really wasn't possible, whatever convergence of your life experiences and where you were and what have you, that's okay too. Although we kind of need to know about that, and that sort of road traveled story, you need to communicate to us a little bit. I will say that I think it's more important to show kind of a longitudinal relationship than it is to sort of say, I've done everything. So I would be happier to see somebody who, say, had been their school paramedics. We see, actually, Well, you applicants are so unbelievable. But there's all these people that apply that are sort of their college has a paramedic team and they're trained as paramedics. So I'm sort of more interested in somebody who's done that for 4 years than I am in somebody who in their fourth year did that, plus they did some shadowing, plus they, volunteered, plus they did some scribing for 6 months afterwards or something like that. So it's more, I want to know what relationship have you had and build these relationships and your interactions with people than any particular event or experience.
So now kind of looking at metrics, things like GPA and MCAT scores, can you comment on how that plays into the application and the decision?
So, I mean, the risk of stating the obvious, higher is better. And it doesn't, it's not, as I was saying, it's not the be all and end all, but it's important. And most medical schools probably do something similar to what we do, whereas that we have kind of a base level cutoff. You got to be this tall to ride the ride. That your combination of your GPA and your MCAT has to be over a certain level. I'm not certain exactly what that is. It's not actually that high, honestly, even here. To sort of, for anybody to then open your application and decide if you're going to get an invitation for an interview or not. But you'd be surprised how many people don't make that base level of the cutoff. So, in other words, there's a lot of people that aren't really qualified who apply. So there's that. So make sure that you do as well as you can. But it isn't the be all and end all with everything. And so once you've gotten to the interview, certainly in our program, it matters. It doesn't matter that much. However, you can go onto the website for Mayo Clinic School of Medicine and you'll see the stats for the incoming class. And I mean, it's humbling. I forget what it is, like 98th percentile is the median MCAT and the median GPA was like 3.8 or something like that, or maybe even higher. I don't know. Yeah, it kills me. But and that's true. There's no question about that. But there is actually quite a wide variation in there, and so that's not everybody in the medical school class by any means. But if again, it's what opportunities have you had? If you grew up with a lot of resources and in a community that had a lot of resources and you could have done everything and you went to a really great school with a lot of resources and things like that, and you didn't have any other particular stressor on you or things like that, and you didn't make those grades or marks, that's probably going to count against you more than if you grew up without a lot of resources and or you had some other stressor. I mean, people who had cancer when they were preparing for their MCATs, and we get people like that, and oh yeah, all right, I'm prepared to accept a lower MCAT score.
So you kind of mentioned in that previous comment there about the interview. So I just wanted to ask a question that one of our panelists had here. So what advice do you have for if you do get an interview, either Mayo, med school, how would you prepare for that? What kind of things should people expect?
So, I mean, I think whether it's Mayo or anywhere, go onto the website for the school and figure out what they're about, what sort of resonates with you about, their mission statements and things like that. Learn something about the opportunities that are available there, what might make that medical school unique compared to another medical school or things like that. I always say, don't get creepy. I'm surprised how many people applying to our medical school specifically call out me in their applications as somebody that they might like to work with in a research lab, and they're really interested. And I'm like, that's great, but my lab, it's strong and good, but it's not big. But there's a lot of people there, and so I think that somebody somewhere has gotten the list of the medical school applications committee, and they said, who's on that? Oh yes, I'd love to do their research. Don't do that, but make sure that you know what goes on at that school and be prepared to sort of talk about that and why you think that would work well for you and what you would bring to that school.
So we have a couple of fellow Canadians on this call, and I believe some other international students. So we've had some questions come in about that. So, do you have any comments on, like, or advice about applying to medical school for international applicants? And then, since you mentioned that you were on the AdCom in Canada, can you kind of compare and contrast what that looks like compared to the US?
So, yeah, in terms of international medical graduates, I mean, I think it varies from school to school and things like that. I actually honestly have a little hard time pinning down what Mayo's policy on this is. And my basic gestalt, and take it with a grain of salt, is that I don't think we really care, what your citizenship is, in terms of our admissions process. As long as you have got the prerequisites and things like that. Where it gets a little bit stickier is, well, what about visas? What about financial aid, things like that? And so, most financial aid, I think, is pretty much limited to U.S. citizens or permanent residents. And so I think that's just something you'd have to recognize if you're neither one of those. And then there are issues about visas and so forth, which our international office can help with. But I'm not fully versed on that as to how that works for medical students. Basically, as long as people have been, they had the prerequisite courses and were good applicants. Otherwise, we didn't really worry about it too much and kind of work out those details as we went along. In terms of the admissions committee process, I would say now fairly similar. I've been saying all along here that I wouldn't have gotten into the medical school or maybe even gotten an interview at Mayo when I was applying to medical school, if I was applying with what I had to apply with at that time. But the truth is, I don't think I would be applying with that because it's pretty clear that you've all got the same playbook. And whether it's in Canada or it's here, everybody's got a little bit more. They fleshed out their CVs maybe more than I did 30 years ago, or 31, 32 years ago when I was applying to medical school. So I think it's pretty similar in a lot of ways, honestly.
So now kind of taking the idea, so we've talked about medical school and then we've kind of talked about being a established neurosurgeon. So if we start looking at the middle ground there, which is residency, so some people are wondering about different options to potentially pursue a PhD during residency. So I was wondering if you could talk about our program here a little bit.
Sure. So, there's different times if you want to get a PhD and be a clinician scientist, you could do it most people will do that as an MD PhD combined thing. Some people get a PhD before medical school. Some people will do it as a completely separate thing other than residency afterwards. There are a few programs in different subspecialties in different places that have done what we've done, which is establish an option for residents to combine that with a PhD. So our residency in neurosurgery is 7 years normally. We have 2 years of that are typically elective time. And we have the graduate school here has agreed to consider our resident PhD applicants as kind of analogous, or resident PhD students as analogous to MD PhD students. So in other words, you get a little bit of credit for time served. You're not repeating the introductory neuroscience class. You might actually be the TA for the introductory neuroscience class. We actually have our students kind of test out of some courses online beginning in their 4th year, while they still have some clinical responsibilities in their 5th, 6th, and 7th year postgraduate. They would be full-time in a lab, working with their thesis advisor, taking all the other course loads and things like that, have written their thesis by the time they finish their 7th year, but not necessarily defended it, come back in their 8th year as a chief resident, defend their thesis, which is typically just a morning or an afternoon if you've got everything all lined up before that point. And then they sort of graduate with their PhD, and then shortly after that, they finish their residency as a chief resident. So it extends the residency by a year, but it doesn't extend it for ever. And it's a nice way to do this so that your research is really very tailored to what your clinical interests are, and you kind of hit the ground running that way. It's not for the faint of heart. You got to work hard. Most people would say getting a PhD is like a really hard thing. doing a neurosurgical residency is a really hard thing. And so now you're saying, well, I'm going to do both of those at the same time. So got to be up for that.
So, similar to medical school, I've heard that neurosurgery residency, it's a very competitive program. And so it seems like we were kind of talking about we've got some international applicants as well here. So, do you have any advice for them, like how to make themselves a strong applicant for a competitive specialty such as neurosurgery?
Yeah, it's hard. If you're an international medical graduate and you're applying to a residency position in the United States, I mean, you don't need me to tell you that that's hard. I think the best I can say is to make sure that you have a connection somewhere to academic physician who's giving you some opportunities, that you've done things with them here, so that somebody can speak to what you are like, what your training has sort of translated to when their interactions with you, and kind of help that way. We do have some international medical graduates in our residency program, but they're typically people that have spent a few years working with us first before that happens, just because it's really hard to know how to interpret, what a qualification from one country means coming to a different country without having had that sort of personal interaction.
Yeah, that makes a lot of sense. So now we've kind of jumped around the whole timeline of education. So we do actually have a couple of high school students on here
Mhm.
that seem very eager. I wish I knew when I was in high school what I wanted to do, like these
Right.
individuals. But do you have any advice for them, how they could get involved early, kind of what their or what their path should look like?
Right. So I think the first question that you have to decide if you're at that stage is, do you want to be aiming towards medicine? As Megan knows, I think everybody should have an open mind about every specialty in medicine, consider them all carefully, be open to all these different ideas, and then choose neurosurgery. But, I think that you want to be open, and particularly in high school where, the real question is, do you want to be a doctor? I think that's where your focus should be. So yes, grades are going to be important. Going to college is going to be important. Working on all those types of things, and then the kinds of things that we've been talking about. When I said everybody's got the same playbook, make sure that you are doing some volunteer experience if you can do that. That you are getting some research experience if you can do that, and that you've done these other things to have clinical exposure and so forth. And if you're not able to do that to the degree that you would like because of other things, your working jobs, you're doing all that kind of stuff, that's okay. Make sure that you got some connections there so that you can say, I did what I could with the opportunities that were available to me.
Yeah, for sure. So I think we're getting kind of close to the end of the hour here. So I'm just going to take one more question. And I think this is a really good one to kind of end on because it applies to all different stages. So, did you ever struggle with imposter syndrome at any point in your career or time in medical school? And how do you deal with that? Because it's such a prevalent thing.
Yeah. My first thought when you asked the question was I wanted to say, well, every day. But I think that's, um, I don't mean to make light of it. And I'll be perfectly honest, I'm sure that I have experienced less of that than maybe people that are different than me, whether it's people of color, different socioeconomic backgrounds, men, women, different gender preferences, things like that. There's a lot of things that sort of go into that. But I guess I would say I think everybody feels that on a spectrum. And it doesn't really go away. The stakes just get higher, I guess. I think you just have to recognize, and one of the things as you get older, you do get more experience, is that you realize that you can actually be an expert in something. I remember being in medical school, having been accepted and just starting and thinking, how are they going to make me into a doctor in 4 years? Because I'm not a doctor right now. And then I realized how much information I had to learn. And I thought, oh, that's how they're going to make me learn to be a doctor here. They're actually going to have to learn all of this. But it's more than that. It's the interactions and things like that. I remember going from, graduating from medical school. One day you're not a doctor, the next day you are. And I thought, well, I still feel the same. I don't think I learned anything more in the last 24 hours. But that's it's kind of a step along the way. And same with residency, writing papers. I remember thinking, who wants to listen to what I write? I'm just some, neurosurgery resident, Podunk University in the edge of the world, who's interested in this. And then you realize, well, actually, if you've taken the time to learn this stuff, you're the expert. And that sort of translates to a lot of different things. So I think it's a question of getting comfortable with that and understanding that that's the case. I do think that it's important to seek out mentors and develop those relationships so that you have people that'll say, it's okay. You're coming along. You actually know this, and you can do this, and that helps. That sort of helps to overcome that sense of I'm not ready to do this.
Yeah, no, and that's definitely great advice that I feel like applies to all different stages of our training. So thank you so much for sharing. So we are at the top of the hour here, basically. So I just wanted to say thank you so much, Dr. Parney, for spending this lunch hour with us. And sorry for making you talk so much. I know I had those questions coming at you quick, but we really appreciate all the advice that you've had to offer for all the students here. And so with that, I think we are done. Anna and Ibrahim, do you have anything else to add before we close?
No, thank you so much, Dr. Parney. It's been wonderful.
I really appreciate it.
My pleasure. So really, this is a great opportunity to be able to speak to all of you, and good luck to everybody with your applications. And I think that, as I said, I hope everybody thinks about all of their options, considers them carefully, then goes into medicine. As they think about all of their options, considers them carefully, and then goes into neurosurgery. So
very sound advice. Yes.
All right.
So just a reminder just a reminder to everyone else that we'll have our panel tomorrow at 6:30 or 6, I believe. Sorry. Yes, 6 p.m. tomorrow. See you all then.